Welcome to the video series, Occupational Therapy for the Stroke Survivor at Home. My name is Alyssa. I'm an occupational therapist and certified stroke rehab specialist. If you're a stroke survivor or caregiver, my goal is to provide you with information and advice to help make your lives easier in the home setting. Any information I reference throughout this video series will be made available to you in the video description. Let's get started. This episode, we are going to review different techniques and strategies for getting both the upper and lower body dressed. Following a stroke, survivors may be left with decreased functional use of one arm and/or leg. This can make day-to-day tasks, such as getting dressed, difficult. However, using the right technique can make getting dressed much easier. Throughout this episode, we will highlight the importance of getting dressed each day, as well as different strategies for upper and lower body dressing for stroke survivors who may have one side of the body that is weaker than the other. Keep in mind as you are learning, no one stroke survivor presents the exact same way as another. The techniques shown to you in this video are simple and effective. However, there may be strategies that work better for you and your caregiver, and that is okay. Completing self-care tasks can maximize independence and improve the quality of life of a stroke survivor. Simply getting dressed can allow a stroke survivor to feel like their self, feel comfortable, and is a simple self-care task that serves as an opportunity for a stroke survivor to maximize their independence in their day-to-day lives. First, we will discuss upper body dressing. This refers to putting on clothing for the top half of the body. For this episode, we focus on simply putting on a shirt. Before putting on a shirt, there are some tips to consider. First, consider the best position for the stroke survivor to be in. Oftentimes, being seated is the easiest position to be in order to put on a shirt. However, depending on sitting balance abilities, the stroke survivor may need to be in a supported seat that has a backrest or even supports on the side, such as a wheelchair, as opposed to sitting on the edge of the bed. Remember, thread the weaker arm through the shirt before the stronger arm or the head. When doing so, remember to thread the shirt all the way up past the elbow. Once the shirt has been threaded over the head and arms, remember to pull the shirt down on the weak side especially. It's likely that the shirt will need adjusting near that shoulder. Lastly, always avoid pulling on the weak arm, specifically when trying to thread it through the shirt sleeve. Let's take a look at some demonstrations. Note the person simulating a stroke survivor getting dressed is wearing a yellow band on her wrist and ankle to note the weaker side of the body so that you can better apply these concepts at home. First and foremost, note the person getting dressed is seated in a supported seat so that she can focus on only putting a shirt on rather than having to maintain her balance as well. The first step is to thread the weak arm through the shirt sleeve. To make it easier, the caregiver bunches the shirt sleeve and reaches her hand through the opposite side to assist with threading the weak arm through the sleeve. Notice the caregiver threads the shirt up beyond the elbow. The stroke survivor is then able to thread their stronger arm through the shirt sleeve. Once both arms are threaded, the shirt can then be threaded over the head and pulled down the back. Remember, it is common that the shirt may get stuck over the weak arm's shoulder and might need greater assistance to be pulled down. Let's watch it one more time, but this time the stroke survivor will put the shirt on with a little bit more independence. This demonstration shows the stroke survivor putting on a shirt with a greater level of independence. This time around, the stroke survivor uses the strong arm to bunch the shirt sleeve herself so that she can more easily thread the weak arm into the sleeve. She then uses her strong arm to gently pull the weak arm through the sleeve and slide the shirt up to the elbow. She's then able to thread the strong arm through the sleeve and pull the shirt over her head. She reaches around to pull the shirt down her back. Although putting a shirt on with one weak arm can be challenging at first, remember it is possible and may take some practice. Keep in mind the tips we reviewed earlier, as this will be helpful to maximize your independence with putting on a shirt. Before we get into some quick tips for taking off a shirt, I want to show you why the technique I just showed you is important. In this video, the stroke survivor threads the strong arm and head before the weak arm. You can see that sure, at first it seems like putting a shirt on this way is going well. However, when it comes time to put the weak arm in the shirt sleeve, you can see she is unable to move that weak arm through the sleeve due to the lack of movement or flexibility. She would require some pretty significant pulling on the arm to get that arm through the sleeve this way, and we want to avoid that at all costs to prevent injury. Therefore, it is very important to thread the weak arm through the sleeve first, even when it can be difficult. There are a few different ways a stroke survivor can take a shirt off. One simple concept to keep in mind is that when you put a shirt on, you thread the weak arm first, but when you take a shirt off, you take the strong arm out first. Another idea is this one. Reach back over your head and pull the back of the shirt collar over your head first. Despite the possible messy hair, this then puts the stroke survivor in a position that allows her to easily slip the shirt off of her strong arm and then her weak arm. This method ensures the protection of the weak arm and maximizes independence with dressing tasks. Let's switch gears to lower body dressing. This refers to dressing the lower half of the body, which could include pants or shorts or undergarments. There are some similar strategies to consider in lower body dressing as there were for upper body dressing. First and foremost, consider the position. It may be easier or safer to put pants on from a laying down position, sitting on the edge of the bed, or even sitting in a wheelchair. When deciding on which position to be in, consider your ability to balance. If you have good balance, you may be able to sit on the edge of the bed or a wheelchair to thread the legs through the pant legs. Additionally, if the stroke survivor is able to stand safely, they may be able to stand to pull pants up over the hips. However, if balance is poor in sitting or standing, pants may need to be put on from the bed level. Always thread the weak leg through the pants first. One of the hardest parts of putting pants on with one side that is weak is pulling pants over the hip on that weak side. Therefore, a stroke survivor may need additional assistance with this part of the task. Lastly, take the time to break lower body dressing into different steps. Maybe the first step of threading the legs through the pants can be done in a seated position, but pulling over the hips should be done at bed level if standing balance isn't safe. Let's get into some demonstrations. This demonstration shows the stroke survivor seated in a supported seat to thread the legs into the pant legs. Notice the stroke survivor uses the strong arm to hold the pants and reaches down to thread the weak leg into the pants first. This requires good sitting balance and coordination in order to lean far enough forward to be able to thread the legs. If the stroke survivor has no movement at all in the weak leg, this can be a very challenging step in lower body dressing and may require assistance from the caregiver to get the pant legs started. Once the weak leg is threaded through the pant leg, the stroke survivor then threads the strong leg through the pants and pulls the waistband up past the knees. If the stroke survivor is unable to lift the weak leg enough to thread the pants over the leg, consider this trick. Use the strong leg and hook behind the weak leg. This will place the weak leg in a slightly elevated position and helps point the toes upward. The stroke survivor is then able to use the strong arm to thread the weak leg into the pants a little bit more easily. The rest of the sequence maintains the same. Once the weak leg is in the pants, the strong leg can be threaded and pulled up beyond the knees. The next clip shows the next step of lower body dressing of pulling the pants over the hips. For this stroke survivor, she is able to stand and maintain balance safely while pulling pants over the hips. With feet flat on the floor, she uses the strong arm to push up from the armrest of the wheelchair to come to a stand as the caregiver stands on the weak side, guarding the weak knee so it doesn't buckle. Please refer to the episode on transfers to better understand how to help a stroke survivor rise from a seated position to a standing position safely. Once standing and maintaining balance, the stroke survivor is able to use the strong arm to pull pants over the hips. She is able to pull pants up over both hips despite increased difficulty on the weaker side. The caregiver here is largely focused on assisting the stroke survivor with balance to ensure safety. however, is able to use one arm to pull pants up and adjust or assist as needed with pulling pants up. Once pants are pulled up, the stroke survivor reaches back with the strong arm and returns to a seated position. If the stroke survivor is unable to stand to pull pants up over the hips or is unable to maintain sitting balance to thread legs into pants, putting pants on from the bed level may be the safest position to complete the task. However, in this position, the stroke survivor may require greater assistance from this position. The steps remain the same. First, thread the weak leg into the pants. This caregiver threads her arm into the opposite direction of the pant leg and gently guides the weak leg through the pant leg. Once that leg is threaded, the stroke survivor is able to bend the strong knee and assist with threading the stronger leg through the pants. From here, the pants need to be pulled up over the hips. The stroke survivor is able to bend the strong leg and pull the waistband up with the strong arm, while the caregiver assists on the weaker side. In order to get the pants over the hips, the stroke survivor is going to have to roll in bed. If you remember from the episode on bed mobility, rolling towards the weaker side with the strong side typically leads to a better roll. In this case, this is a helpful tip because not only does rolling this way allow the pants to be pulled over the hip, it allows the stroke survivor an opportunity for more independence with pulling them over her hip herself. She then rolls the other direction, which the caregiver may have to assist to pull the pants over the hip on the weaker side. As a caregiver, be sure pants are not crooked or wrinkled, as this can lead to discomfort or even skin breakdown, especially if the stroke survivor is going to remain in bed for a prolonged period of time. Note that though we demonstrated pants in this video, this is also how undergarments, shorts, or adult diapers or briefs can be put on or taken off to prepare for self-care tasks or just to get dressed. Throughout this episode, we reviewed dressing techniques for a stroke survivor, specifically one with reduced function or movement on one side of the body. Remembering some basic principles can improve independence with dressing. Always dress the weaker side first. Remember, choose the safest, most functional position for dressing tasks. Don't forget to maximize your independence with your self-care tasks. Get dressed so that you can feel like yourself, get more comfortable, and be more independent with your self-care. Thank you for watching. I hope this video helped you as a caregiver or stroke survivor with maximizing independence and improving your quality of life in the home setting. Please utilize the comment section below with any questions or comments about the video. Stay tuned for more episodes. Thanks again for your support.